Hi, I'm Mac Pierson, and today I will be discussing aiding performance and injury reduction, examining knee separation distance in a dynamic task. I'm supported by my co-authors, Dr. Louisa Raisbeck, Dr. Robert Henson, and Dr. Christopher Ray, and we all represent the University of North Carolina at Greensboro. The ACL, or anterior cruciate ligament, aids our bodies in running, jumping, and moving side to side. Roughly 150,000 people will sustain an ACL injury this year, the majority being athletes. Women and girls are at a higher risk than men and boys to sustain this injury. While this injury is devastating in many capacities, post-ACL injury can be just as debilitating, as early onset arthritis can occur, unable to return to sport, loss of confidence and ability, monetary loss are just a few. A risk factor for ACL injury is hip-knee alignment, or the relationship between the hip width and the distance between the knees during movement. The closer to 0 this number is, represents a more aligned knee and hip. As you can see in the equation we use to determine this measurement is fairly simple. As we see in the picture to the left, hip-knee alignment is not ideal. The knees are in a slight valgus. However, the picture to the right, there is better hip-knee alignment, and the knees are almost parallel to the hips. But how do we gain or strive for better hip-knee alignment? The newest motor learning theories have not been fully explored in the ACL injury prevention world. It is known from past literature that an external focus of attention has aided some physical therapy, athletic training, and rehabilitation settings. But better learning, retention, and transfer of skills have been seen. One theory that has limited application to ACL injury prevention is optimal theory. Optimal theory is made up of 3 factors: an external focus of attention, autonomy of support, and enhanced expectancies. An external focus of attention is focusing on the outcome of the task rather than your own body and motion. Autonomy of support is when the participant feels as though they have some control in the situation. We typically utilize this by letting the participant choose when they receive feedback or rest. Enhanced expectancies is having a false sense of confidence. We have the participant believe they are doing as well as their peers or even slightly better. This application of optimal theory brought us to our aim of our study, which was, does optimal theory aid learning, retention, and transfer in dynamic tasks? Our study consisted of testing 60 total participants, divided randomly into 2 groups, our optimal theory group and control group. There were no statistical differences between the groups at start. Our study design consisted of a pretest for both our main task of a basketball rebound and our transfer task of a maximal effort vertical jump. This occurred for both groups. The only difference between groups occurred during the practice block. As you can see, the directions are to the left. The optimal theory group received instructions that encompassed all 3 components. All participants then did a post-test to end day 1. On day 2, 24 hours later, a retention test occurred for both groups with no instructions given to either group. A 2-group by 3 time period ANOVA was conducted for the average hip-knee alignment in both tasks. The alpha was set at 0.05. If significant group by time interactions occurred, a one-way ANOVA was used to determine which group showed differences, and a paired samples t-test was then used to determine at which point there were significant differences. For our main task of rebounding, we found that there was a significant group by time interaction for hip-knee alignment from pre to post and pre to retention. As you can see in our table, our pretest values were fairly similar, but the post-test and retention results for the optimal group were significantly lower, while the control group stayed relatively the same. For our transfer task of maximal effort vertical jump, we found there was a significant group by time interaction for hip-knee alignment from pre to post and pre to retention. As we can see in our table, our pretest values were fairly similar, but the post-test and retention results in the optimal group were significantly lower, while the control group stayed relatively the same. To conclude, while hip-knee alignment is somewhat controversial, it is still marked as an ACL injury risk factor. It is also considered to be a performance factor. Using the optimal theory and instructions given, participants aided hip-knee alignment better than the control group. An important aspect of the study was the transfer piece. A goal of ACL injury prevention programs is to teach proper movement, but there is no way to teach each and every movement an athlete may undergo during competitive play. The ability to transfer better hip-knee alignment to other non-practice tasks could have a large impact in ACL injury prevention. Optimal theory has also aided the effectiveness of learning, retention, and transfer. Participants spent roughly 1 hour on day 1 learning with instructions. This was an effective way to alter mechanics to negate the risk of injury. This study also opens the door for further investigation into more dynamic movement and application for the optimal theory. Thank you for your time today. Please don't hesitate to reach out with questions or comments. Thank you.